In today's segment, paid for by Total Health Chiropractic, did you spend this past weekend doing very little because of that severe neck and chronic back pain?
Well, many have been, like you before, opting for surgery, but the pain is still there. Dr. Miller at Total Health Chiropractic offers a non-invasive option with his DRX 9000. Are you still in pain after having spinal surgery, and are you looking for something that's more of a long-term solution? Well, Dr. Miller at Total Health Chiropractic has a non-invasive procedure that he can offer up to you, and he's actually worked with Elaine here. We'll get to her story in just a minute. So thanks so much for joining us this morning.
Thanks for coming out to our office, Leanne.
Absolutely. So let's talk about this. What are these people going through?
Well, it's tough when people have chronic degeneration of the spine. Not only is it neck or back pain, but it affects their ability to function and live the lives that they want. Many can't move and walk the way that they want, or sometimes it can affect the arms where they're not able to prepare, meals or do chores around the house. And then to add to that, the options that they're given to help relieve that pain or those symptoms usually is about just symptom relief, and they're not really working on fixing the cause of that pain. It could be medications, physical therapy, sometimes injections at pain clinics, or even, as you mentioned, neck or back surgery. And not only are they invasive, but they're not really fixing the cause of that pain. They're just treating the symptom. And there's a lot of side effects with this, especially shots and surgeries. And then there's even been studies that show even spinal surgery, I think, has between a 10 and 46% failure rate. And then when you go back for consecutive follow-up surgeries, second, third, and fourth, it's even less effective. So it's a tough situation for a lot of those people to get in. And once they get to that point, doctors don't really have anything else they can recommend. And unfortunately, that's a lot of patients we see are in that situation when they first come to our office.
So let's go ahead and talk about what you are able to offer these people that's non-invasive.
Yeah, and that's the number one thing, Leanne, is that we don't do invasive treatments, so no drug shots or surgery. And we really work on fixing the cause of that pain. So we have a variety of treatments. We find it usually is more than just one treatment that it takes to correct those conditions, but we do offer conservative chiropractic care, nutritional recommendations. We do a lot of rehab and different unique rehabs with our patients. And then something a lot of patients come to us for is our DRX 9000 therapy. It's a medical device to help regenerate and heal injured discs like degenerative disc disease, bulging or herniated discs, things like sciatica, spinal stenosis. A lot of times they'll have arthritis in the mix as well. And when we work on fixing that condition and getting their backs healthier, then they're able to go kind of live the life that they want to once again.
Absolutely, and this is a great time to transition over to Elaine. Thanks so much for joining us this morning.
Thank you for having me.
Absolutely. Let's backtrack a little bit and tell us a little bit about the situation you were in before you came to see Dr. Miller.
I have had numerous surgeries for other problems before my back started bothering me. And because I've had so many surgeries, I said I was not having any more surgery. I happened to catch a segment on television of Dr. Miller explaining his DRX machine and some of the things that he does, and I decided to look into it.
And so as you started coming here, what did you start noticing about the way you were able to feel, and actually tell everybody maybe about if it was comfortable going through the procedure?
Right from the very beginning, I went to a seminar to start out with and listened to Dr. Miller give nothing but facts and information. It was a very informative seminar. I called the next day, made an appointment. 2 days later, I came in, met with everyone. I brought in my x-rays and all my other things that I had. They took some x-rays. We sat down. He explained to me what my problem was. He showed me on my x-rays what my problem was, what I probably would be facing down the road if I did not get better at it. And the next day, my husband